Arthritis is a disease causing inflammation of the joints. There is a connective tissue made of cartilage between the joints, and that lubricates the joints so that you don't feel the pain when you walk. Basically, the disease starts causing inflammation of the joints, the tissues around the joints, and connective tissues around the joints. This is a disease which has now become very common among aged women, men, and also several types of people who have genetic issues. That means this disease can be inherited from generation to generations. There is no permanent cure for arthritis. You see, at best you can contain it if you manage it properly. There are several body enzymes responsible for the onset of arthritis. Human body, several organs, and also certain immune system are also contribute to this disease. Arthritis is, to a large extent, is affecting the women population above the age of 50 due to a number of factors. Appropriate post-delivery rehabilitation, the depletion of the vital nutrients and other things in the human body by lactation, that's not given to the mother, which means her body becomes very weak and immune system becomes weak, and eventually several reactions takes place in the body which starts attacking the cartilage. Normally, this disease is mainly seen in the knee joints, and treatments are given to ameliorate it. Initially, the osteoarthritis starts by pain in the knee, followed by inflammation, difficulty in walking, and eventually you need a knee surgery to replace the cartilage with synthetic materials. It has become very common now. But many people do not know the fact that the various enzymes and reactions in the body, physiological and biochemical, which contribute to the disease, they are not suppressed. When they feel the knee is no longer a source of attack, they will start attacking other parts of the body. So arthritis develops in all the other joints in the human system. This is something we have to understand. Secondly, how do people develop arthritis? There are several factors that contribute to arthritis. One is age-related issues. By aging, your system becomes weak. Nerves and various tissues, the growth and regeneration is slowing down, and this contributes to the degradation of the cartilage, which is in between the bone. Secondly, sex. Women, by and large, is a victim of osteoarthritis. 60% of women suffer from this. Initially, they will not care it. Their lifestyles, sitting in the same postures, doing domestic work, and various types of lifestyle activities eventually affect the joints, and deterioration of the joint starts. But they will ignore. Finally, inflammation starts, and eventually they find it difficult to perform various body activities. The stiffening of the joints and inflammation is the fullness or called the final development of the disease. And arthritis, you cannot cure 100%. At best, you can take precautionary measures, you can make treatments and eventually manage it. The best thing that you have to do is, when you feel the knee pain or a joint pain, consult a good orthopedic surgeon. Undertake treatments immediately. Arrest the progress of the disease so that it should not get aggravated. Eventually you become immobile. That many people ignore. Normally what they do is, they apply some ointments, they make their own treatments, self-treatment initially, without knowing the facts. It's different from other type of inflammations normally takes place in human body, because on application of drugs and medicines, the pain subsides, inflammation subsides, and you will be recovered, and it may not come back again. But in case of osteoarthritis, even after treatment, the disease is not to leave you. It will be there, it will continue to be there. That's why I say you have to contain and manage the disease. If it remains not cured, even after treatment, you can confirm that you have an arthritis. And remember, there are several types of arthritis, depending upon the type of infection you get, your lifestyle, your health conditions, your genetic factors, your aging. You have different manifestations of the disease, and it's very important that the first step towards cure of arthritis is to diagnose, identify what type of arthritis you are having, and then to take the appropriate treatment in right direction.